My name is John Snedeker. I'm the clinical director here at LaSara Medical Group in Orange County in Los Angeles, California. We specialize in men's sexual health. And in this video, I'm going to discuss the differences of focused shockwave therapy versus pressure waves for the treatment of erectile dysfunction. The reason for this explanation is to help men who are suffering from erectile dysfunction find a treatment center that is using the appropriate medical device that's been proven to reverse erectile dysfunction. Of course, the ultimate goal of any treatment for erectile dysfunction is to take a man back to achieving erections naturally and fully without the use of medication. And that is exactly what a focused shockwave therapy device does. Unfortunately, there is a lot of misleading information across the internet, so we'd like to provide a perspective so you too can ensure that you find the right provider for your treatment. It's important to understand in the world of treating erectile dysfunction, a low-intensity focused shockwave device is the preferred medical device used to treat erectile dysfunction. This has been proven over the last 10 years in both clinical studies and medical settings across Europe, Australia, North America, and Asia. In the United States, the exact focused shockwave device used for the treatment of erectile dysfunction in a majority of the clinical studies has only become available in the last year. And at LaSara Medical Group, we are the first to deploy this device for the treatment of erectile dysfunction in all of Southern California. When erectile dysfunction is caused by a true vascular disorder or blood flow disorder, a man will start to notice that his erections become a bit less rigid and his length and ability to maintain that erection begins to decrease over time. Unfortunately, these two symptoms tend to get worse and worse over time until a man is unable to experience any degree of an erection. The good news is focused shockwave therapy can be used to do three things to reverse erectile dysfunction. The first is focused shockwaves stimulate the body to grow new blood vessels into the penis. The best way to think about this is you're putting fresh plumbing in. Fresh pipes equals maximum blood flow to achieve an erection. Second, there are hundreds and hundreds and hundreds of vessels inside the penis that with age and other natural consequences of life can become prematurely hardened or begin to essentially close up. Shock waves can actually revitalize these vessels, essentially breaking through the old ones, allowing for new ones to come into the space. Third, healthy tissue inside the corpus cavernosum is capable of considerable enlargement in both girth and length when you have a healthy erection. But when you have erectile dysfunction for a long period of time, your penis loses its ability to actually expand because the tissue becomes very weak. Shockwaves help to restore its elasticity and its ability to fill and maintain blood flow for a full and long erection. Additionally, shockwaves attract stem cells into the penis, which are beneficial for the repair of damaged tissue. Effectively, focused shockwaves treats the root cause of erectile dysfunction, that being a vascular disorder, as compared to other modalities like a Viagra or Cialis, which is just an on-demand treatment to get the blood flow you need. With focused shockwave therapy, we restore your ability to have a natural and spontaneous erection again. The alternative option, which unfortunately is a quite painful treatment and produces only about less than half the results of focused shockwave therapy, is referred to as acoustic pressure wave therapy, acoustic waves, radial waves, or ultrasound wave therapy. The results are often negligible with pressure waves or radial shock waves because the energy does not reach the corpus cavernosum where the blood vessels live. Without reaching the corpus cavernosum, we're unable to trigger the response of repairing the tissue and stimulating the body to grow new blood vessels into the penis. During treatment with acoustic pressure wave therapy, just about every single patient is required to use a numbing cream just so they can endure the pain of the treatment. The device actually feels and sounds like a miniature jackhammer. And if you're doing your own research, you might find that acoustic pressure wave does come at a lesser cost, but remember this treatment is painful and the results are few and far between. To close this all up and provide you the tools you need to make sure you have found the right provider, I'd like to leave you with two questions you can ask of your doctor. First question is, do you use a focused shockwave therapy device as proven in all the clinical studies to reverse erectile dysfunction? Or do you use a radial shockwave, pressure wave, acoustic wave, or ultrasound wave for your treatment? If the latter, they're not using the device clinically studied or proven to reverse erectile dysfunction. Second question is, does the treatment require your patients to use any sort of numbing cream? If the answer is a yes, then this device has not been clinically studied or proven to reverse erectile dysfunction. We hope that this video has been informative for you and it's given you the tools you need to identify the right practice for you in your treatment of erectile dysfunction. At LaSara Medical Group, we've truly seen unbelievable results with our patients using focused shockwave therapy, taking some men who haven't even had an erection in almost a decade, now being able to have spontaneous sex again. If you're in Southern California and you're experiencing erectile dysfunction, if you're tired of taking the pills, if you're tired of injection therapy, and you're even considering doing a surgery, then come visit us at one of our Southern California locations. We'd be more than happy to answer your questions and get you back on the path to recovery of being able to have spontaneous erections again.